You fall asleep fine. Then, around 2 in the morning, you're wide awake, heart racing, sheets damp, your mind already running through tomorrow's entire to-do list, even though it's still the middle of the night. You lie there for an hour, maybe 2, and by the time you finally drift back off, it's almost time to get up and do it all again. If that's your life right now, you are not imagining it, and you are not broken. A 2026 survey from the American Academy of Sleep Medicine found that 37% of women between 45 and 64 report frequent nighttime waking, 35% deal with night sweats or hot flashes that disrupt their sleep, 29% report increased daytime fatigue, and 27% struggle just to fall asleep in the first place. Only 6% say their sleep hasn't changed at all during menopause. That means for roughly 19 out of 20 women, something real is happening at night.
Most doctors will tell you this is just part of getting older. Some will hand you a sleeping pill, tell you to cut back on caffeine, and send you home.
But what's actually happening in your body is far more specific than aging. And once you understand the mechanism, the fixes make a lot more sense. In the next few minutes, you'll learn exactly which 3 hormones are sabotaging your sleep and why they're doing it now. 5 things that actually help, with real doses and real timing. And 2 things almost every woman tries first that quietly make the problem worse. Let's start with what's actually changing. Sleep isn't controlled by one hormone. It's a coordinated handoff between 3 of them. And during perimenopause and menopause, all 3 lose their rhythm at roughly the same time. That's part of why this feels so disorienting. It's not one problem, it's 3 overlapping ones wearing the same disguise. The first is estrogen. Estrogen helps regulate your body's core temperature and supports serotonin production, which your brain converts into melatonin, the hormone that actually puts you to sleep. As estrogen drops, your internal thermostat becomes unstable. That's the mechanism behind hot flashes and night sweats. Your hypothalamus, the brain's temperature control center, starts reading a completely normal body temperature as too hot and triggers a cooling response in the middle of the night. Vessels dilate, you sweat, your heart rate climbs. You wake up flushed and damp, even though nothing in the room actually changed. The second hormone is progesterone. Progesterone has a calming, almost sedative effect. It interacts with GABA receptors in the brain, the same receptors targeted by anti-anxiety medications like benzodiazepines. Progesterone is often the very first hormone to decline in perimenopause, sometimes years before estrogen drops significantly. That's why so many women in their early to mid-40s report trouble falling asleep and a new kind of nighttime anxiety, seemingly out of nowhere, long before they'd ever describe themselves as in menopause. If this sounds like you and you're only 43 or 44, that's not too young for this to be the cause. The third piece is cortisol, your primary stress hormone. Estrogen normally helps keep cortisol on a healthy daily rhythm, high in the morning to help you wake up and feel alert, low at night so your nervous system can power down. When estrogen drops, that rhythm flattens out, and cortisol tends to run higher in the evening than it should, right when it's supposed to be tapering off. That's the 2 in the morning, wide awake, mind-racing feeling. It isn't insomnia in the traditional sense. It's your stress hormone spiking at the exact hour it's supposed to be at its lowest, which is why it so often comes with a racing heart or a sudden wave of anxiety for no clear reason. A 2024 study published in Menopause, the Journal of the North American Menopause Society, tracked hot flash frequency directly against nighttime awakenings using overnight monitoring, not just self-report. It found that 69% of hot flashes were immediately followed by a waking episode, and those episodes accounted for over a quarter of all the time women spent awake during the night. This isn't in your head, and it isn't just getting older. It's measurable, hormone-driven physiology happening on a predictable, trackable schedule. So why doesn't this get addressed directly? Part of it is time. A 15-minute doctor's visit doesn't leave much room to walk through 3 interacting hormone systems. Part of it is that standard blood panels often come back normal even when a woman is deeply symptomatic, because a single blood draw is a snapshot, and it can't capture the daily hormonal swings that are actually driving the problem. And part of it, honestly, is that sleep complaints in women over 50 get quietly written off as stress, aging, or just menopause, a label that describes the situation without explaining it and without treating it. Understanding the actual mechanism, estrogen, progesterone, and cortisol, each playing a distinct, separate role, is what makes it possible to target the problem instead of just enduring it night after night. Here are 5 things that actually address these mechanisms directly, not just mask the symptom for one night and leave you starting over tomorrow. Number 1. Magnesium glycinate. This specific form of magnesium supports GABA activity in the brain, the same calming pathway progesterone normally supports, and it relaxes skeletal muscle, which helps with the restlessness that often comes along with night sweats. Take 200 to 400 milligrams about 30 to 60 minutes before bed. Glycinate is the form to look for specifically. It's gentler on digestion than magnesium oxide or citrate, and it crosses into the brain more efficiently than most other forms. Most women notice a difference in how easily they fall back asleep after waking within 1 to 2 weeks of consistent use. Number 2. Phytoestrogens, specifically soy isoflavones. These are plant compounds that weakly bind to the same receptors estrogen uses in the body, which can help take the edge off vasomotor symptoms, like hot flashes and night sweats, without hormone therapy. You can get these through food, a serving of edamame, tofu, or tempeh most days of the week, or through a standardized supplement providing 50 to 100 milligrams of isoflavones daily. The research on this is strongest for reducing hot flash frequency over an 8 to 12 week window, so give it real time before deciding whether it's working for you. Don't judge it after 4 days. Number 3. Black cohosh, a standardized herbal extract that's been studied specifically for menopausal vasomotor symptoms for decades. Look for a product standardized to 1 milligram of triterpene glycosides, typically dosed at 20 to 40 milligrams twice daily. It doesn't work for every woman, but in the women who do respond, it tends to reduce both the frequency and intensity of hot flashes within 4 to 6 weeks of daily use. If you're on any liver medication, or have a history of liver disease, talk to your doctor before starting. This is one supplement genuinely worth clearing with a professional first. Number 4. Morning sunlight exposure. This one is free, and it directly targets the cortisol problem we just talked about. Getting 10 to 15 minutes of natural outdoor light within an hour of waking up helps re-anchor your cortisol rhythm, high in the morning, tapering down as the day goes on, the exact pattern that estrogen used to help maintain automatically. Consistency matters more than intensity here. You don't need direct sun on your skin, just genuine outdoor light. Even on a cloudy day, outdoor light is many times brighter than indoor lighting, and your circadian system needs that daily signal to reset the clock that governs both cortisol and melatonin release that night. Number 5. Paced breathing, done proactively, not just when you're already awake and your heart is pounding. The technique is simple. 6 to 8 slow breaths per minute, in through the nose for a count of 4, out through the mouth for a count of 6, for 5 to 10 minutes before bed. Clinical research on paced respiration in menopausal women has shown it can reduce both hot flash frequency and the intensity of the ones that do happen, most likely by calming the same autonomic nervous system pathway that triggers the hypothalamus to misfire in the first place. Give any of these 2 to 4 weeks before deciding whether they're working. Hormonal symptoms don't respond overnight, but they do respond, and combining 2 or 3 of these together tends to work better than relying on just one. Now here's what most women try first, and what quietly makes this worse instead of better. Mistake number 1, a glass of wine to take the edge off before bed. It's one of the most common habits among women in perimenopause, and it backfires in 2 specific ways. Alcohol causes blood vessels to dilate, which can directly trigger a hot flash a few hours after you fall asleep, often right in the middle of your deepest sleep window, when you can least afford the interruption. It also fragments REM sleep, so even if you technically stay in bed for 8 hours, the actual quality and depth of that sleep drops significantly. You wake up feeling like you barely slept at all, because on a physiological level, you didn't. Mistake number 2, reaching for over-the-counter sleep aids like diphenhydramine, the active ingredient in most PM pain relievers and sleep pills, night after night as a default. These are anticholinergic drugs, and while they will knock you out, they don't touch the actual hormone mechanism causing the problem in the first place. Used occasionally, for an especially rough night, they're not a major concern. Used nightly for months at a time, research has linked long-term anticholinergic use to next-day brain fog and, in some longer studies, increased long-term cognitive risk. It's treating the symptom while leaving the actual cause completely unaddressed, night after night. Mistake number 3, cranking the air conditioning down and treating that as the entire fix. Cooling your bedroom genuinely helps, and it's worth doing regardless. But treating temperature as the whole solution means you're managing the hypothalamus's false alarm instead of calming the alarm system itself. Combine a cool room with the hormone-targeted steps above. Don't let it replace them, or you'll be stuck adjusting the thermostat for the next 10 years instead of fixing what's actually driving it. Here's the bottom line. Your sleep didn't break for no reason, and it isn't just part of getting older. Estrogen, progesterone, and cortisol are 3 specific identifiable systems shifting at the same time, and each one has a specific evidence-based way to support it, starting tonight. If this video gave you something new to think about, hit the like button and subscribe. We post a new video every Tuesday, covering exactly this kind of topic for women navigating this stage of life. Visit healthhustleacademy.com. We've put together the exact supplement stack and wellness tools we talk about in our videos, all in one place, so you don't have to go hunting for them yourself. All links are in the description below. Take care of your body. Nobody else is going to do it for you.